We begin this hour with a nationwide announcement by the Nigerian Association of Resident Doctors, which says the body will embark on a nationwide daily protest to insist on its demands, which is believed have been neglected by the Ministry of Health and the federal government. The protest, which is scheduled to begin on Wednesday, will include picketing of the Ministry of Health, Office of the Head of Civil Service, as well as the federal and state tertiary institutions across the country. The association had embarked on an indefinite strike on the 26th of last month over agitated issues, despite interventions by the Secretary to the Government of the Federation and the Speaker of the House of Representatives. The recent decision taken by the association's national executive comes barely 2 days after the Ministry of Health instituted the no work, no pay policy against the striking doctors. And for more on the proposed nationwide protest by resident doctors in Nigeria, I'm being joined by the national president of the association, Mr. Orji Innocent, and he joins me from Abuja, live from our Abuja studios. Good to have you on the news at this time. So first off, tell us the reason behind the association's decisions to go on an indefinite strike, and what specific demands do you feel the government hasn't addressed during the negotiations?
Thank you for having me. Unfortunately, none of the demands have been met, and we have been on this for some years now. And as we keep negotiating with government, some of these challenges have become urgent. And one of them is the fact that we have said severally that we do not have enough doctors and nurses in the hospitals because of the effect of massive brain drain. Government has agreed with us. They set up a committee last year. The committee came up with a policy on one-for-one replacement, which was agreed on February this year. And it was said that the policy will be secularized by the Office of the Head of Civil Service of the Federation. 5 or 6 months after, that circular is yet to come out. And people are still living. You see, these demands are clear. The public know that if they visit our tertiary hospitals, that they take time before they see their doctor. In fact, some of them spend days there without seeing doctors. Some of them come to the emergency department, you don't have doctors there, and you bring in trauma patients and they die. What do you think is causing that? It's because you don't have the numbers anymore. And we are saying this policy that you've agreed to, secularize it so that the chief medical directors can leverage on it and quickly replace those that have left so that the system will become functional again. We've talked about the payment of the Medical Residency Training Fund for 2023, which was captured in the budget. We have been on this in January. This is August. It has not been paid. The Registrar of the Medical and Dental Council that talked about our engagement in the National Assembly, one of the issues that we raised there was the fact that our membership certificate has been downgraded without any cogent explanation. We asked that question in the National Assembly. There was no adequate explanation given to that because that same certificate is being issued by other West African countries, and there has not been any downgrading of their own certificate. We've also talked about a lot of salary arrears, and we all know that the current economic condition, means that people will have to be supported by one way or the other for them to be able to fuel their vehicles to go to work. And so these areas have accumulated. We have doctors who have not been paid months of salary by the federal government. And so exactly how are they going to be able to cope with work? Part of the Hippocratic oath we took, which they administered to the doctors in Ogbomoso, says that we have to be in good health. We have to be able to take care of our own health and needs for us to be able to deliver health services of higher standards to Nigerians.
All right, point taken there,
A
Mr.
hungry
Orji.
doctor is a dangerous doctor.
Point taken there. Let me quickly come in here. But first off, how do you feel about the government's no work, no pay policy against the striking resident doctors, and how do you think this will affect the ongoing strike?
It has affected it negatively by aggravating the situation. You see, people just feel very angry. That's for the ministry and the other agencies that have failed to honor their own agreements. They had an agreement with us. In May this year, a conciliatory meeting was called during our warning strike. We had an agreement, an MOU was signed. All the timelines in that MOU have passed without them implementing it. And when we have come back to say, please implement what you've agreed, time has passed, they refuse to do that, and we started agitating. It is the same ministry that is saying they are going to implement no work. Where is the fairness? Where is the justice? You cannot be the one breaking agreement or refusing to implement the agreement that you reach with an association. And when they agitate, you are now the one trying to punish them for agitating. It is simply not going to work. Our members are saying that if by Wednesday this week these issues are not resolved, we have no option than to picket all the tertiary hospitals in the country, including the Ministry of Health in Abuja and the Office of the Head of Civil Service of the Federation, because these issues are germane, they are urgent, and we believe that this government can resolve it.
Right, fine, point taken there. But, there's a concern here about the impact this would have on public health. But what is the association planning to take during this strike to balance its demands while also considering the potential impact this would have on patient care and public health?
The impact that it's already having without our intervention is much more. I have just told you, except you don't agree with me or Nigerians don't agree with me, that our hospitals are massively depleted. If that is the case, what have they said about people who have been dying there, who have been suffering morbidity of inadequate care being given to them because we don't have numbers? And this has happened over years. What have they said about our members who die almost on a weekly basis because of the workload they have to grapple with? What about those who are breaking down? What about those who are having, depression, who are having burnout effect of this brain drain? For how long are we going to continue to live like this? Certainly, our members are saying that they have had enough. And we have said this before. We are calling on Nigerians, we are calling on the government to come to our aid and resolve these issues. These issues can be resolved. The only thing is that we believe that people who should address them, rather than take steps, urgent steps to address them, they are going to issue memo on no work, no pay. See, we are professionals, and they should understand that nobody is afraid of that no work, no pay, because that is actually what has aggravated this situation. They should pay more attention in addressing the issues we have raised, and not to be looking at punitive measures, which has ended up aggravating the problem.
All right.
We repeat that this government has capacity to address these challenges, and we are appealing to them to do the needful before the Wednesday we slated for this.
All right, Mr. Orji Innocent, National President of the Association of Resident Doctors, thank you so much for your insights on the news at 10 tonight.
Thank you.